In-N-Out Burger with a side of Ozempic.
That sounds like a disaster that's about to happen. Jaclyn Hill is an OG YouTuber who just put out a YouTube video talking about her Ozempic journey. I am not here to criticize Jaclyn Hill or any patients who's wanting to get on Ozempic for weight loss. I'm here to deep dive into healthcare and critically look at some of the situations where healthcare might be going into the wrong directions. Let's dive in.
It's Ozempic time. It's time for the big O.
Are we sure it's supposed to go there?
What do you mean?
I don't know where you're supposed to inject it.
Baby, why does it matter?
It pisses me off that it's clear that someone had dispensed this medication to her and not give basic instructions how to give the medication. The injections are subcutaneous. They are meant to be given around the belly button. There are multiple other options. You are dispensing a medication to a patient. You need to tell them how to use it correctly. I'm sorry, I'm already getting heated. This is so annoying. Okay.
I was microdosing a semaglutide twice a week, right? Meaning like what normal people would inject with on Monday. I was injecting with on Monday and Thursday, but I was breaking it in half. That way I didn't get an upset stomach. I did that for a month and I just did not see results at all. I lost, I think, 1.5 pounds.
First of all, it's pretty normal to use a medication off-label using a dose that was not studied. However, when we go off script like that, we need to then provide the patient with realistic expectation of, okay, this is not the dose that the drugs were studied in. Therefore, your response to the medication may not be the same as what you've heard, for example.
My doctor has now switched me to a different peptide and I just injected it.
It's very frustrating because it's like she probably didn't even need to be on a different peptide. She probably just needed to be on the correct dose. Like, what the heck?
I have now been on this new GLP-1 for 3 weeks. Tomorrow will be 3 weeks. I have now lost 10 pounds officially. So this one has definitely worked. My doctor told me to stop working out for this week, just for like the last 2 weeks actually, just so that my body could adjust to it because I was feeling really weak in class because I am consuming such little food compared to before. I feel like I'm used to it. The nausea is pretty much gone. I just don't have much of an appetite. And I probably had like 300 calories at lunch. You know what I mean?
You know, at this point of the video was when I got really creeped out. If anybody comes into the office, into a healthcare setting, saying that they have been trying to lose weight, the method in which they're doing it is to reduce their calories so much that they are weak. They can't even work out. They're not nauseous anymore, but they're not eating. This is a form of malnutrition that is medication induced, doctor monitored, doctor approved. At what point are healthcare providers enabling toxic behaviors that could very much resemble a form of disordered eating? Sometimes just because we can doesn't mean that we should. And our oath is to do no harm. So what the hell are you doing? This is such a tricky topic, but it does worry me. It scares me. I think that's it. If you like me deep diving into healthcare and pharmacy news, then make sure you follow for plenty more to come.